Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care. I am affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is psychedelic medicine. Joining us today as my guest speaker is Dr. Cassius Drake, who is a past emergency medicine physician, and right now he is doing practicing the psychedelic medicine at the Drake Center. Mm-hmm. He will highlight our viewers about what it is and also what is the role of ketamine therapy in the psychedelic medicine. So good morning, Cassius, and welcome to my show.
Good morning. Thanks for having me. Yeah, pleasure to be here.
First of all, will you please give your introduction to our viewers?
Sure. So, as you know, I'm Dr. Cassius Drake. I was an ER doctor for a couple of decades.
Yeah.
Ran an ER for a time, and for the last 4 or 5 years, I've been the founder and medical director of the Drake Center for Transformative Healing, where we provide ketamine-assisted therapy.
Just like me, you got also burnt out with emergency medicine, right?
20 years was enough.
I tell you, that was a lot for me. But that's
it's a heavy job.
Yeah, so now this is so much updated therapy, the ketamine therapy. So please tell our viewers, how does ketamine differ from the other traditional treatments?
Sure. So ketamine, as your viewers may or may not know, has been around for about 60 years. It was originally FDA approved as an anesthetic. And it's a synthetic derivative of PCP, which is what gives it its psychedelic properties. And so over the last 15, 20 years, there's been a renaissance of the use of...
FDA approved the therapy for ketamine.
Well, not quite yet for ketamine, but it's so we're using it off-label. But it's there's been a renaissance of psychedelics, and so as part of that, ketamine has been used to treat depression, anxiety, PTSD, and quite a few things, and we use it as part of our program at the Drake Center.
So basically, for our viewers to know, it has been used right now with the depression, especially among the children, adolescent, or anybody.
So we treat 16 and up, and it's very effective. Just as a solo treatment, it can be used as a treatment for treatment-resistant depression, and it helps with lifting mood and has an even sustainable effect. People have noticed that one treatment may last for a couple of weeks, and in addition to that, its psychedelic potential has the ability to open people to see things in a different way, and to change their perceptions of things. And this really, in our practice, we support them in integrating that into their lives so they have long-lasting benefit.
So that is very important, the integrated part, because I was reading, studying the Google, and so integration is a good part that you combine it with the other treatment.
It's essential. So, the combination of the two, of ketamine with therapy coaching or integration, helps support people in evolving and growing into themselves, and becomes it elevates the treatment from just being an antidepressant to something that actually supports people in evolving in their lives.
So you get the people who are already on some medication, and then with the addition of this, it has a better prognosis, right?
It has an incredibly huge prognosis. We often see people actually go quite often into remission from depression, meaning they don't have any symptoms for months or even years.
That's what I was reading, and very amazing, isn't
of sustainable benefit. And so it's really quite revolutionary in its ability to frankly help people heal. right? So most of the time, I saw a very interesting. This is an aside. This is a tangent. I saw an interesting thing. They were interviewing a group of psychiatrists, and they were asking them, "How many patients have you cured?" Okay, this group of psychiatrists, and about 4 or 5 of them, they would go, "How many patients have you cured?" And they went, "Well, in 20 years, none." And then another one was like, "Well, I don't think I've really cured anybody." And out of 4 or 5 people, that was the answer from the psychiatrist, is that basically the gist of it is you're just managing symptoms and not really doing anything else.
Not going into the details.
It's just a Band-Aid, and that's better than the alternative. Now, psychedelics and ketamine in general have ability of taking that antidepressant effect and more. And opening so people can shift their relationship with the past, shift their relationship with the future if it's anxiety, find a way to be present today and go, wow, life's okay today and it's good. And that's a real feeling for them.
Acute anxiety reaction and all that. So I was reading through all this, and they said it was synthesized in 1962.
Yeah, at Wayne State, as a matter of fact.
At Wayne State, that is very interesting. And then FDA approved it for anesthesia in 1970.
Yeah, so it's been around a long time. Yes.
It has been a long time.
Yeah. And we used it in the ER. We used to use it to sedate kids all the time. Probably gave it thousands of times. So it's really safe. It's really safe. It's very well tolerated. And its benefits to help people evolve and see things differently are really transformative.
Also, during my periods when I worked at emergency room, urgent care, if a child comes with a deep lacerations or something, they use it to sedate the child before they do the sutures, lacerations.
Yeah, so you got 30, 40 minutes to do what you needed to do, and then the child would be awake and drink juice and go home, right? And so, what was interesting about that is that we never used it on adults. Remember, we were told we were told not to use it on adults because they would have emergence delusions. And in retrospect, when I think about that, is if you're ketamine is a psychedelic, right? So if you give someone a psychedelic in the ER without telling them that's what they're getting. You tell them this is something for pain or it's a sedative, but it's actually a psychedelic.
Actually, a psychological effect.
And so you have that and you're in the ER and it's a stressful environment and you get this shot and you go someplace else. Well, you're going to be like, wow, what is that? But, we've realized that, when you talk to people ahead of time, and you let them know what's about to happen, that it's a completely different experience. And adults can have a very positive, transformative experience with it.
So now, the dose of how much do you use? What is the usual dose? They are available in capsules and
it's in multiple forms, so you can get it as an oral lozenge. It comes as a nasal spray. That's what I was going to ask you about. The nasal. The nasal spray is purely for symptomatic treatment. So it's purely
symptomatic treatment.
You go and you squirt it up your nose yourself. You have to be washed a couple of hours, and then that method, it works to reduce depression symptoms. But as far as really helping people advance in their therapy or mature or grow or move past things, it doesn't really do that as much. We use injectable ketamine in our protocol, so we give them a shot of ketamine at about a third of the anesthetic dose. So if we're using it for anesthesia, it's a shot. We might give 3 or 4 milligrams per kilogram. But for our purposes, when we're using it for depression or PTSD, we're using a third of that dose.
Yeah. So suppose I send a patient to your Drake Center. So can you just give for our viewers' sake, when they go there, what do they expect? Whom do they see? I know they must be seeing the therapist and.
So they see myself and my partner, and
you and your partner,
and we do all the work. So they initially meet with us, and we have an intake visit. We get to know them and their background, and make sure this is right for them. And then we have a preparation session, and we get them ready for it. And we have a wonderful environment at our center for them to have it, and then they come on the third visit, and they get their ketamine treatment. treatment, and it's usually a remarkable positive experience for our patients, and we support them through and then help them to make sense of it on the other side. For example, if you have depression, depression often rests on a feeling of hopelessness or why bother or why would I try, and that's sort of their internal soundtrack, right? And then they have this ketamine experience, and within that ketamine experience, maybe they hear something different. Maybe they hear, things are going to be okay, or I'm
sometimes
okay,
hallucination,
right? Well, and it's a real emotional experience that they have. One that they can hold on to. And once someone's had a feeling of hope, then we talk about how do you keep that. See, this is what's different. This is what makes this a different form of therapy. When people do normal talk therapy, they often just talk,
right?
And they learn all about themselves and learn themselves about themselves, but don't feel any different. They understand themselves, but they feel exactly the same. And within this experience, they have the opportunity.
You are integrating.
Well, in this experience, they have the opportunity to just feel different. To feel hopeful. Okay, and then once you've had a chance to feel hopeful, then we talk about how do you hold on to that? Here's how you can keep that. Here's some tools and some practices, and we teach them some breathing techniques and meditation. We do creative work and lots of things to help them support it.
But then, for an adolescent or a young adult, who are going through a lot of stress in their life, probably some alcohol or anxiety reaction, how many sessions will a person like that will need? When they go to your center?
Most people need 4 to 6.
4 to 6?
4 to 6. So our program is 6 treatments and 6 integrations over about 2 months. And usually by the time they get to that 6th one, which some people don't even need the 6th one. Some people get they're pretty good by number 4 or 5.
They might get better even before that, right?
Yeah. So sometimes they get better before and they're good. And then they'll be good for a while. And they might come back 6 months later, a year later. But the vast majority of our patients, they really get what they need and they move on with their lives.
So that's good to know, because these days, so many things happening at the school campus, the college campus, so many temptation to, to get involved. We all know we don't need to, mention anything. So many disturbance. So if they can get to the bottom of this, then probably for our viewers probably 4 to 6 therapy will help them lead the normal life, right?
It can certainly support them.
Normal life.
And getting better. And we know our youth are really challenging right now. And
challenges are so much.
And, our young men are really challenged right now. So the young adult males, late teens, early 20s are really struggling in life right now. And this can be useful for them in regaining a sense of purpose. And remembering, the positive aspects they are of masculinity, which is challenging for many people.
So that's good. It's a good thing to know, about how to improve. How can they, once their thoughts are great, once they are back to themselves with the therapy, then they can develop their own motivation, right? What they want to do in their life. Because it's such an immature age for them, isn't it?
Well, and this is it can be useful to help them find their passion. Find their passion for life, or figure out what's my purpose, what am I here, what am I supposed to be doing, and sort of lift that cloud. I think a lot of our young men are losing their direction, and processes like these can support them in finding that.
So this was where I did a lot of reading on this. I do have experience while working at the emergency room or urgent care, kids with the depression. When I was working at the Henry Ford, usually, we send them to Maple Grove, where there are a lot of psychotherapists and all those, And I thought, they did a good job, but for me, very hard to follow up on them.
Yes, yeah.
But if somebody goes to your center, mostly they are able to do the follow-ups.
Yes. So we that's our whole program is about a holistic approach to supporting them through the whole thing. So you have the treatment, and then you're feeling better. Here's how to stay better. Here's how to be more creative, be more physically active. Elevate your spiritual life, and really support people in all of these areas.
Right. Yeah. So basically, the ketamine, the main effect is the work at the neuronal junction.
Yes. Right.
Yeah, and so the serotonin is liberated.
Yeah, so it's ketamine stimulates.
Ketamine stimulates SSRI. It goes good with the SSRI, right?
You can be on an SSRI and take ketamine. Yes.
And extra this.
Yeah, and take ketamine. Ketamine works by increasing glutamate, which is the neurotransmitter, and causing increased neurostimulation.
There are beautiful pictures of the dendrites, and then how it works. That's very good. Yeah. So the nasal spray that has just recently come in the market, is it
Spravato, yes.
Spravato.
Yeah,
okay.
Spravato. So, Spravato is a subtle tweak of generic ketamine. If you remember your chemistry, there's a right-hand version of a molecule and the left-hand version of the molecule. Remember the isomers of the molecules?
Yeah.
Okay,
isomers.
so generic ketamine has a right-hand and a left-hand version. Yeah. Spravato is just the left-hand.
Spravato is the left.
It's just the left-hand, the L isomer. So it's a subtle tweak of the ketamine molecule. It's not that different, and that form, they did go to the FDA, and that form is approved to treat depression.
It is just recently approved.
It's been around for a few years. Yeah. It was the first FDA-approved psychedelic. There's some others in the pipeline that may or may not get approved.
Yeah, but this is the one that is approved now for the nasal spray. And when do those kids or the adults use that spray? When they are in the acute phase?
So it can be used when you're in an acute phase for acute treatment, and people do find that it reduces their symptoms. The Spravato paradigm, you continue to take Spravato for an extended period of time, so it just sort of becomes another antidepressant, which for us is that's better than the alternative. We like to see people get the full benefit of ketamine and get the full experience and really make that change in their lives.
Acute anxiety reaction, they could use it.
Yes. Yeah. People use it for that. So
because anything that goes to the nasal mucosa absorbs fast. Yep. Better than pills or better than.
Yeah, better than the orals for sure, but less less effective than the injectable.
That the injection. So injections is the more effective.
Yeah, that's our way that we do it. Yeah.
Right. So that's very good. It's so good to know, and I'm so happy that you you are here to add to my knowledge about the psychedelics and all that. I have read a lot, and I did a lot of articles on them also. Especially, post-COVID era, there are so much of depressions.
So much
among children, adult, and even the senior citizens.
Well, who's left out of that post-COVID depression is the healthcare workers.
Healthcare workers.
Think of all the healthcare workers that were working during COVID in the ERs and in the ICUs that themselves are still carrying a lot of that. And this process helps with that. That's something that we're really passionate about, and something that we're bringing into our work now is healing the healers, and really working with burnout in healthcare workers and health professionals, who are dealing with those things, and this can be very effective.
So the healthcare workers also
in supporting our colleagues in regaining their passion for healing. Remembering why we do this job, and that can be lost very easily these days.
So bottom line is mind-body syndrome, right? And along with this, you can use yoga.
Yeah. All of those adjuncts come,
Yoga,
are very
exercises.
effective. So those things are much more effective once, on the other side of this treatment. And then people find that meditation and yoga and creativity and physical fitness all, elevate and support them in the work in being, stronger, more whole people.
Yeah, so that's great. I can see all this, how the yoga, meditation, how, so for an average, what are the advices you will be giving for these people, who are under treatment, they are getting better, but for their post-treatment, would you advise exercise, yoga?
Yeah, so we advise them to bring, a group of practices into their lives, to be more physically fit, more active, to get,
More
move
active.
around, to, engage in their passions, ask what are their passions, what are their purposes, why am I here, and am I connected with that? So we encourage them to think about those things, to get out and be of service to people, to, go out and to show people what it looks like to feel better.
Exactly, right.
And that's a big part of it.
So do you offer group session therapy also?
We do. We have a support group that
Okay.
our former patients come and they meet. We meet once a month,
Once a month.
A lot of our symbology is about butterflies and transformation. Journey of a caterpillar to a butterfly. So our support group is called the Kaleidoscope Club.
Yeah.
A kaleidoscope is a collection of butterflies, right? So that's our support group.
Yeah, so that is very interesting, to see all those artistic things make years. So it's amazing, isn't it, how the world is changing?
Really is.
How the world, before, you are depressed, what do?
There weren't many options.
Not many options at that time.
There weren't many
Hey, you get over your depression yourself. The same thing, I did a lot of work upon the winter-related depression, seasonal affective disorder, and the bottom line is the same, right?
Yeah, get out and move and be active and
Be
and
active
engage
and
in
the
things.
light.
Yeah,
And-
get in some light
And the light therapy, especially these days, it's so gloomy right outside.
yeah, for sure.
Yeah, and another thing, we forgot about the diet.
Well, yeah. So we, eat
good-
healthy. Yeah, don't eat fast food. Avoid. We find that people stop emotional eating.
Yeah.
And they're, they eat healthier. We also find that people just sort of naturally stop using substances. We'll find that people who are drinking will say, I just don't feel like I didn't want to drink anymore, or that's like, what. I stopped smoking. I just feel like I really just didn't want it anymore.
Right.
And that happens quite a bit. Or people with stress-related illnesses, the migraines or their IBS, or even their eczema. When they're calmer and less stressed out,
Itching,
those things, those things get better
Okay.
too.
So that's good. I think diet plays a very important, significant role, right? If you avoid fatty food, going to McDonald's, cheeseburgers and those, it will add to the weight, but it's not going to be good for inside, right?
Yeah, it doesn't. It's not good for the mood.
Not good for
Right.
good for the mood. Yeah. So we talked about the depression. We talked about the nutrition. What is your last minute keynote to our viewers?
I guess the last thing I'd want to say to people is just to understand that there is an option.
Right.
That there are new ways of addressing these
New
issues,
modalities.
and they're incredibly effective. And so there is there is an opportunity for hope that people suffering from depression can get better. You can get to the other side of PTSD and feel safe again. You can learn how to feel comfortable in the moment. And be able to trust the future, and those things are all possible. And it takes a little bit of work. It's not magic. It takes a little work, and you have to go through the process. But when you do, it's incredibly effective.
Right.
And we've had just a number of people just changing their lives, and they're often being butterflies. As we say.
That is right. Yeah, that is very good. I like that. So, on behalf of our television series, Health Talk, I like to thank you very much for coming to our show today.
Thanks for having me.
There is so much to learn about this ketamine therapy. I cannot go into the detail because it will take a couple of hours. So my next series is going to be cigarette smoking and e-cigarette, advantage and disadvantage. And I'm sure it is linked to this also.
Yeah,
You can use this therapy with that. So, that's going to be my next. So I like to thank you. I like to thank our viewers for watching me today on this show about the psychedelic medicine, especially the ketamine therapy for depression among adolescent, young adults, and senior citizens. I did not have time to talk about those.
We've had patients up to 84.
Right, I know. I didn't have time to talk about those. And my producer for helping me produce this wonderful tape. Unless I see you guys again, have a safe, wonderful rest of the winter.
Yes, you
We
too.
sure hope to see some more light, right,
hope
for our brain.
Please.
Thank you again.